Well, hello there. My name's Adrian Cosenza. I'm the chair of the Australian Ethical Health Alliance, and it's my great privilege to be asked to share the Australian journey by Terry Cantu, the head of the Mexican Ethical Health Alliance. And thank you, Terry, for giving me an opportunity to say a few words about what we've done in Australia and to maybe just comment about some of the issues that's been facing in Australia. I might start off, if that's okay, just by sharing a few slides with you very quickly. Hopefully you can see all that on the screen. So it's just an outline of our journey about how we built an ethical framework and an alliance of organisations to strengthen ethics and ethical leadership. There was the emergence of an ethical movement really occurred towards 2017, and in 2018, Australia presented at the Tokyo APEC meeting its national consensus framework, and the consensus framework really is made up of a series of substantive principles and a set of procedural principles. And it's a consensus of shared values and ethical principles that form the basis of collaboration and interaction amongst organisations in the healthcare sector. There are presently 78 member organisations representing 25 million consumers or patients and over 1 million health professionals. And you can see here it covers 8 sectors in the health ecosystem. The focus has been on advancing ethical leadership through organisational frameworks and structures. And so what we first did was develop an implementation plan for the first 3 years of the Alliance. And it focused on structure, it focused on providing guidelines and self-evaluation, and it focused on communication and engagement. And the sorts of things that were achieved were governance documents and steering committee terms of reference. We had a communications working group. We prepared material for publicity. There were certain events that we identified that we would attend. We had a media and a communications plan. We launched quite a series of, we launched a website. We published articles. We held things like this, like symposiums. We joined other groups in talking about the key message here, the ethics of COVID-19 vaccination. We spoke about ethics in the healthcare sector and its importance in a time of crisis. We tried to develop tools that could assist our members, like self-evaluation forms, with about 30% of the membership, they're voluntary completing them. And the sorts of things, these are the sorts of things that our ecosystem got involved in. They took the principles and sought to internalize those principles. And I won't read all of those, but these are the sorts of things that were covered off. And when we completed that first 3-year plan, one of the issues was around momentum. How do we keep this momentum going? And so we brought together about 40 of the participants with a lot of the leaders, and we then developed, we spoke about a vision, and the vision being to achieve an equitable, sustainable and ethical health system that advances the health, wellbeing, interests of patients, communities and the healthcare sector. And we were very clear about what the purpose was. We were about promoting collaboration, interaction. We're about enhancing integrity and trustworthiness. It's about promoting public confidence and trust and really encouraging dialogue. And the key areas of focus are really about advocacy and awareness, trying to embed ethics in everything that we do right across the system, and the actual ongoing sustainability. How do you go about keeping this momentum? And ethical practice is achieved when leaders and their organisations manifest ethical values and virtues, such as integrity, accountability, trustworthiness, and that organisations are clear about their ethical obligations and aspirations, and they lead and shape ethical debate. And I think this is one of the great platforms. Our lessons so far We feel like ethical leadership needs to be modelled as well as taught. It needs to be reflected in and supported by the organisations in which health leaders work, and it requires clearly articulated ethical frameworks and robust structures. So that sort of concludes, I guess, the journey. One of the things that Terry's asked me to talk about are what sort of issues of integrity that we've confronted here in Australia, and how do we go about trying to incentivise organisations to get involved? And look, the short answer to the second one is it's very difficult. The lessons that we've learned is that the more there is interaction and engagement, the more conversations that occur, the more of bringing various parties around the table, the greater there is an opportunity for understanding, for problem resolution, for looking at issues from other lenses. What we've also found is that by doing that, people learn from each other. And so a problem in one sector is a similar problem in another sector. And sometimes sharing those problems assists in the resolution of those problems. One of the areas that Terry asked me to talk about was, what do we need to do? How do we incentivize the healthcare professionals? Now, each system is very different. In Australia, a lot of the colleges, medical association and so on, they all do have their own codes of conduct that the doctors are required to respect. And in many respects, from that point of view, within their own profession, and obviously allegiance to the Hippocratic Oath and so on, there is an ethical backbone to that. I think where the challenges are is where there's interaction with some of the other sectors and the sorts of behaviours that are expected. And in many respects, sometimes it's about education. If you don't educate people about what is the right thing to do, well, they don't really know. And so that's why education and modelling is something that we focus quite a bit on. In terms of integrity, that was one of the other areas that Terry asked me to talk about. I think at very many parts of our ecosystem, whether it is the medical device, intersection with medical device or intersection with pharma, the intersection between the professionals and government and so on, it does require at its heart individuals, whether they're doctors or whether they're members of medical device companies or public officials. It requires an ethical and a moral compass to do the right thing, not to take advantage of situations. And I think that's something that we've tried to help have conversations about and have examples of cases where, we call them ethical dilemmas. And so we look at these. We've done these from time to time. We held an ethical dilemma forum where we ran a hypothetical case with a number of players from different sectors, and we had an audience in there. These were doctors, were in this particular audience, and we just role played those things out. So these are the sorts of things that you can do to continue to educate. Look, I hope that's helpful. I was asked to keep the recording short. I'm going to conclude it there, and I'd really like to thank Terry once again for the opportunity. I really wish the Mexican Health Alliance, Ethical Health Alliance, the very, very best, and to let you know that here in Australia, we are your friends. We are always available to have a conversation, to share our experiences, and I really look forward to seeing many of you in Lima next week. Thank you and goodbye.